Hey guys, so I decided that I wanted to do a video about my birth plan. This is probably more so for my sake. I also want to share with you guys what I had in mind for my birth, but here's what I mean by it being for my sake. So I know enough, like I've seen enough YouTube videos, heard enough birth stories, know enough people who have had babies to know that each birth is unpredictable and there is no way to plan it, and really it's a bad idea to get your heart set on one particular way to give birth because inevitably it's going to go a different way. So I thought it would be really fun if I recorded a video about my birth plan when I'm 38 weeks pregnant, so I haven't given birth yet, and I thought it'd be really fun for me to have like a pre and post, like have a memory of what I sort of thought might happen and how I pictured it going so that I could look back and compare to see what actually happens. So I'm just going to quickly share some of the things that I wrote down on my birth plan to give you guys an idea of what I have in mind. So before I start out, I want to explain that so I'm a type 1 diabetic, which what that means is that it kind of takes certain things out of my hands. Like I don't have complete control over how this is going to go because I'm giving birth in a hospital. It's a birth center, but it's the hospital's birth center, so it's very much a medical environment. And they have certain protocols that they follow when it comes to diabetic patients. So for example, most likely you're going to be induced. Usually it's at 39 weeks. My doctor is letting me go till my due date, but I will be induced unless I go into labor naturally before that. They will hook you up to IVs, so whether or not you're induced, all diabetics get hooked up to IVs. So there's just a couple of examples. There are certain things that are out of my hands, and I'm just going to have to work with because I want to have my baby in the hospital so that I'm in a safe place. I don't know what to expect, not just for the baby, but for my sake. I don't know what to expect after I give birth, like what's going to happen with my blood sugars, whether or not there's going to be an emergency situation. So I want to give birth in a hospital. That being said, there are certain things that are out of my control. The other thing I want you to know is that I think birth is awesome. I've always been really fascinated by pregnancy, labor, delivery. I just think it's amazing, and I'm one of those crazy people who has always wanted to experience a natural labor and delivery. Now that doesn't mean that I think that that's the only way to do it. I'm just saying that that's always been my dream, is to experience what that feels like. I think epidurals are great, C-sections are great, there's time and a place for that, but I just want to know what it feels like. I really want to know what a natural labor and delivery feels like. I want to experience the pain. And I know that sounds crazy, but it's just something that I've always wanted to experience. So what I did for my birth plan was I wrote out, I tried to keep it really concise. I wrote out a small section about my labor preferences. I'm calling them preferences because these aren't demands. I know that I need to be flexible, so I'm calling them preferences. I wrote out my birth preferences, so that's like when I'm pushing. I wrote out afterbirth preferences, so what I would like to happen when the baby's out. And then I included a little section about if I'm having a C-section, what my preferences would be in that situation. So starting out with the labor preferences, I've said here that my preference is to have natural pain management. So that means basically no pain meds, no epidural. Now I am probably going to be induced, and that's most likely going to include Pitocin. And I have heard that Pitocin inductions can be a lot more intense. You hear mixed things, but basically the consensus is that Pitocin contractions come on faster and stronger, and so it can be a little bit more difficult to go without an epidural because your body doesn't have that time it needs to like gradually get to that pain tolerance level. You know, in a natural labor progression, it happens more gradually, and with Pitocin, it happens all at once. So my preference is natural pain management, so that includes movement, breath, using my ball, my exercise ball, my birth ball. I want to have access to use the whirlpool tubs that they have at the birthing center and the shower. Water can be really good. I've also requested intermittent fetal monitoring if possible. Now, I know that I may need to be hooked up continuously to fetal monitoring if I'm induced, but if possible, I would like it to be intermittent, again, just so that I can have the natural labor pain management, because the more you can move, the more mobile you are, the better chance you have at getting through the contractions without drugs. I've included that I don't want to be offered pain meds. So my husband and I have a plan in place that, I'm realistic. I'm not crazy about like, it's gotta be natural. I don't care. I just want to try and see if I can do it naturally. And my husband and I are coming up with a system to know when I'm serious about wanting an epidural. So if it gets to a point where, who knows, I could labor for like 48 hours and just be exhausted, and then what's happening is not effective anymore. I might need the epidural. So we have a code word, we have a system in place where he's gonna let me ask for it 3 times, and only on the 3rd time will it be the real thing. That way it gives me the the ability to ask for it, because sometimes it just feels good to ask, like, give me the epidural. But he's going to count to 3. So he's going to give me 3 times throughout labor to ask for the epidural. And by the 3rd time, he'll know that I'm serious. And we're going to have a code word. So I don't want to be offered pain meds before that. Since we have the system in place and he'll know when I really want the epidural, I don't want it to be dangled in front of my face, because that's the last thing you want when you're in pain. Someone saying, I've got something that could take this away. So I've said, please don't offer me the epidural, wait till I ask. I've also included on my birth plan who my labor support people are. So my primary support person is my husband. And he's been doing research, and he's read a book it's called The Birth Partner. We did birth classes about different birthing positions and massage techniques. So he's going to be the primary support person. And then my secondary support person is my mom. And she also read The Birth Partner, and she's getting prepared to know what to do in labor. And so the 2 of them are going to team up to be the birth partners, so my support people. And I've also included that I hired a birth photographer to photograph a little bit from labor, and then the birth, and then post-birth, and I've included her name, so that the nurses know who she is. Now, about birth preferences, my section when it comes to actually pushing. I've said that I want to be able to use different positions. I don't want to just be on my back. Like, maybe I want to try squatting or being on hands and knees when I push. I've included that I want to push when I feel the urge to push rather than being coached when. Now, that also will depend on whether or not I've gotten an epidural, because sometimes if you have an epidural, you can't feel the urge to push. So that'll depend on if I manage to go naturally. I've said that I want to use a mirror to see the birth of the baby. I want to be able to touch the baby's head as it crowns. I would prefer not to have an episiotomy, but to tear naturally if need be. And I would like my partner to catch the baby. That's something that he wants to do. And my doctor has already read through my birth plan, and she surprisingly was okay with that. So if it's my doctor who delivers this baby, she'll be fine with my husband being the one to catch the baby. So that'll be interesting. We'll see how that goes. And so then my afterbirth section, I've said that I would prefer delayed cord clamping, which I already know that my OB does that with all of her patients, so that shouldn't be a problem. I would like immediate skin to skin for as long as possible, assuming that the baby's in fine health. I would like my husband to cut the cord, and I would like to breastfeed right away as soon as the baby starts rooting. So I want that immediate skin to skin, and that breastfeeding relationship to start as soon as possible, or as soon as the baby wants, and as soon as that happens naturally. Now, finally, my section for my preferences are if I have a C-section. I've said that I want my partner present at all times during the operation. I would like the screen lowered so that I can see the delivery of the baby. My doctor explained that they can use a clear screen so that I can watch that, and so that's what I would have, a clear screen. I would like the surgery explained to me as it's happening. So I'm the kind of person who actually gets more anxious if I don't know what's going on. Medical stuff doesn't freak me out. I'm not bothered by blood or anything like that, and I would so rather know what was going on than just be lying there and having people with their hands inside me. So I've said that I want the surgery explained, like okay, now we're cutting, now we're doing this, now we're doing that, now we're getting the baby, blah, blah, blah. I would like the baby to be shown to me and have eye contact with me, and if possible be placed on my chest for skin to skin in the operating room as soon as possible after delivery. So again, like just trying to keep that, you know, really important skin to skin thing even if I have to have a C-section. I would like the birth to be photographed by my birth photographer. And if I'm unable to have skin to skin with the baby right away, I would like my husband to be able to do skin to skin with the baby and be with the baby at all times. So if the baby needs to go to the NICU or whatever is happening with the baby, I want my husband to be present at all times with the baby. So I also just have a couple little notes about my plans. Like I have a little thing here about feeding. I plan on breastfeeding exclusively. And I say, please do not give my baby formula. I've said donor breast milk is okay, so if they need to supplement, like if her blood sugar is low, donor breast milk is okay. And I've also said that I would appreciate assistance from a lactation consultant. So those are just added little things. The last thing I'm going to say about my birth plan is the very first thing I wrote is a note to my nurse. And in this section, I just included a little bit about me so that she could know a little bit about my personality before, you know, having to deal with me. So I included the fact that I'm the type of person that likes to ask a lot of questions. I've experienced before in hospitals and doctor settings where sometimes if you ask a lot of questions, they almost feel like you're threatening their authority or challenging their authority. Like, why are you asking me this? That's not what I'm doing. I just like asking questions and knowing what's going on. So I included that in my note to my nurse. I like to ask questions, and I've said thank you so much. I appreciate your expertise, and just so you know, I'll probably be the type of person to ask you a lot of questions, but it's just because I'm curious, blah, blah, blah. So I feel like that's important to give my nurse a little idea of who I am and what to expect, so that we can have a smooth sailing relationship, because I have been told that, you know, your nurse that you have throughout the labor, it's so important that you have a good relationship with that nurse. It can make or break the whole experience. So anyway, that's my birth plan. If you have any questions, go ahead and leave them in the comments down below. I'm going to be really interested to see how my actual birth differs from this image of like what I have in my head. So we'll see how things change, and if for no other reason, I just think it's really fun to have a record of, you know, the idealistic things I was thinking before I actually gave birth. So that's it, and I will see you guys in my next video. Bye!